Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. 0.13 Reasons why you have a pink discharge. A pink discharge from the vagina commonly occurs with spotting before your period. Seeing a little pink after wiping may also be a sign of ovulation, the release of an egg, or implantation bleeding that can occur with early pregnancy. You may also see a pinkish discharge after sex as tiny tears in vaginal tissues mix with vaginal mucus. /r/n/r/n If you experience a pinkish discharge outside of your regular menstrual cycle and suspect you are pregnant, you can take an at-home pregnancy test. If the discharge is persistent and accompanied by symptoms like fever or pelvic pain, call your gynecologist to have it checked out. /r/n/r/n On rare occasions, vaginal bleeding may be a sign of more serious conditions like endometriosis or even cervical cancer. /r/n/r/nFreshSplash, Getty Imagesrnrn A. Pink discharge is not only common during stages of your menstrual cycle but can also occur as you approach menopause. /r/n/r/n A. Pink discharge can develop at the beginning or end of your period. It is the result of menstrual blood mixing with clear vagina fluids. Irregular or light periods that persist for a few days can also appear pink. /r/n/r/n Some people experience spotting during ovulation when an egg is released from the ovary. The light spotting may be pink-hued and occur roughly 14 days before your next period. Cervical fluid is clear around this time, so any blood would create a pink shade. /r/n/r/n Light bleeding from ovulation is usually not a problem. If you experience any ovulation pain, known as asmittelschmerz, you can treat it with an over-the-counter, OTC, pain reliever like Tylenol, acetaminophen, or a heating pad. /r/n/r/n In most cases, light spotting before or after your period is not a cause for alarm. However, if spotting is persistent or if your periods are suddenly irregular, see your healthcare provider. /r/n/r/n Fluctuating estrogen levels are characteristic of perimenopause, the transition period leading to menopause. As estrogen levels rise and fall, irregular spotting and periods can occur, sometimes causing a pink discharge. /r/n/r/n Perimenopause usually begins in one's 40s, causing additional symptoms such as /r/n/r/n estrogen replacement therapy, in pill, patch, spray, gel, or cream form, can help normalize hormone levels and relieve many of these symptoms. Antidepressants can help manage mood swings, while the drug Neurontin, gabapentin, has proven effective in easing the severity or frequency of hot flashes. /r/n/r/n After sex, some people experience light spotting, otherwise known as postcoital spotting. This usually occurs when the vagina is irritated from excess friction, particularly when not enough lubrication is used. /r/n/r/n Additional lubrication may be all that is needed to overcome this concern. But if bleeding continues despite ample lubrication, see your provider to have it checked out. /r/n/r/n A pink discharge can occur soon after fertilization and implantation of the egg and several weeks later during early fetal development. It can also occur as an early sign of miscarriage. /r/n/r/n Implantation bleeding describes spotting or light bleeding that some people experience shortly after a fertilized egg has implanted into the lining of the uterus, womb. 1 or 2 weeks after this happens, the spotting might appear pinkish depending on how much bleeding has occurred. /r/n/r/n Implantation discharge may also be accompanied by cramping or a pulling sensation in the abdomen or lower back. Symptoms tend to resolve in a couple of days. Implantation bleeding is generally light, stops on its own, and doesn't require treatment. /r/n/r/n Loci is vaginal bleeding that can occur 4 to 6 weeks after childbirth. The discharge often begins as birth red, heavy bleeding before gradually easing and turning a light shade of pink. /r/n/r/n lochia can cause the discharge of tiny blood clots. If the discharge smells foul or involves large blood clots, see a healthcare provider to rule out a potentially serious infection. /r/n/r/n outside of infection, lochia doesn't require treatment other than the use of extra sanitary pads. Do not use tampons during this time. /r/n/r/n signs of a miscarriage, the loss of pregnancy, include vaginal spotting, which can be light and pinkish. This would usually occur before the 20th week of pregnancy. /r/n/r/n seek immediate care if you experience other signs of miscarriage, including /r/n/r/n if no pregnancy tissue is left in your womb following a miscarriage, no treatment is needed. If some remains, you may be prescribed medications to help discharge the tissue or undergo a procedure called dilation and curettage, D&C, to have it removed. /r/n/r/n hormonal birth control can lead to an estrogen imbalance that causes breakthrough bleeding. This is especially true when you start a new form of hormonal contraceptive. In such cases, the pink discharge will gradually ease and start to resolve after a few months on the new medication. /r/n/r/n if spotting does not stop, you may need to consider a different method of birth control. Speak with your healthcare provider. /r/n/r/n it is that also worth noting the irregular use of birth control pills can lead to spotting. By taking your pills at the same time every day without interruption, you may be able to overcome breakthrough bleeding. /r/n/r/n different types of vaginal infections can lead to a pink discharge, including common yeast infections and those caused by sexually transmitted infections, STIs. /r/n/r/n vaginal candidiasis, also known as a yeast infection, is caused by the overgrowth of a fungus commonly found in the body, called Candida albicans. Infections can occur when your immune system is down or when taking antibiotics that disrupt the normal vaginal biome. /r/n/r/n K discharge is common when a yeast infection is severe, caused by the disruption of vaginal tissues. /r/n/r/n other symptoms of a yeast infection include /r/n/r/n most yeast infections can be treated with a short course of topical or intravaginal antifungal drugs. /r/n/r/n pelvic inflammatory disease, PID, is inflammation of the upper genital tract due to an infection, most commonly STIs like gonorrhea and chlamydia. The disease affects the uterus, ovaries, and/or fallopian tubes, sometimes causing a pink vaginal discharge. /r/n/r/n in addition to spotting and a pink vaginal discharge, PID can cause symptoms like /r/n/r/n treatment of the underlying infection can help ease PID symptoms. Your sex partner should undergo testing and potential treatment if you've been diagnosed with an STI. /r/n/r/n uterine fibroids are a type of non-cancerous tissue growth inside the uterus. The cause of fibroids is unknown but is thought to be associated with genetics, vitamin D deficiency, obesity, high blood pressure, and never having been pregnant. /r/n/r/n although many fibroids cause no symptoms, some people may experience light vaginal bleeding that can appear pink when mixed with clear cervical fluids. /r/n/r/n other signs of uterine fibroids may include /r/n/r/n hormonal contraception is most commonly used to reduce bleeding. A drug called leuprolide, can help shrink the fibroid and reduce heavy bleeding. Severe cases may require surgery to either remove the fibroid only, myomectomy, or the fibroid along with the entire uterus, hysterectomy. /r/n/r/n endometriosis is a chronic condition where tissue similar to the endometrium, the lining of the uterus, grows outside the uterus. Endometriosis is most common in people between the ages of 30 and 40. /r/n/r/n endometriosis can cause episodes of heavy bleeding during periods. In between periods, endometriosis can cause spotting, light bleeding, or a pink discharge. /r/n/r/n Depending on where the abnormal tissue growth occurs, endometriosis can also cause other symptoms such as /r/n/r/n Tylenol and OTC nonsteroidal anti-inflammatory drugs, NSAIDs, like Advil, ibuprofen, or Aleve, naproxen, can help ease pain, while hormonal therapies can help suppress ovulation and periods. Surgery can be used to remove or destroy the excess tissues, known as endometrial ablation. /r/n/r/n Polycystic ovary syndrome, PCOS, is a hormonal disorder that causes the formation of fluid-filled cysts on the ovaries. PCOS causes hormonal imbalances that can lead to infertility and irregular periods. /r/n/r/n People with PCOS typically have androgen levels. These include hormones like testosterone associated with male sexual development. /r/n/r/n PCOS can cause abnormal menstrual periods with a pink discharge rather than a full flow. Other symptoms include /r/n/r/n PCOS can be managed with lifestyle changes, hormonal therapy, anti-androgen drugs, acne treatment, and procedures like electrolysis to remove unwanted facial or body hair. /r/n/r/n Cervical cancer is a rare cause of a pink vaginal discharge. An early sign of cervical cancer includes vaginal bleeding after sex and between periods. In the United States, cervical cancer is the 20th most common cause of cancer, affecting around 13,800 people annually. /r/n/r/n Cervical cancer is often asymptomatic, symptom-free, in the early stages but can lead to other, more overt symptoms as the disease progresses, including /r/n/r/n The treatment of cervical cancer depends on the type of cervical cancer you have and how far the cancer has spread. Treatments include surgery, chemotherapy, and radiation therapy. /r/n/r/n Vaginal discharge can come in a variety of colors and consistencies. Some of these changes may be completely normal, while others may be a sign of a potentially serious disease. /r/n/r/n The types and causes of discharge can be broadly described by the following chart. /r/n/r/n Vaginal discharge is common. For some people, the amount of discharge can fluctuate daily due to medications, sex, menstrual cycle, and other factors. /r/n/r/n In most cases, an occasional pink discharge isn't a cause for concern. However, you should call your healthcare provider if the discharge is persistent, worsening, or accompanied by signs and symptoms like /r/n/r/n If you suspect you may be pregnant, you can take an in-home pregnancy test and confirm a positive pregnancy test result with our healthcare provider. /r/n/r/n Pink discharge that happens before your period, after sex, or at the start of new hormonal birth control may be normal. This can occur when light vaginal bleeding mixes with clear cervical fluid, appearing pink. /r/n/r/n Other less common causes of a pink discharge include early miscarriage, uterine fibroids, pelvic inflammatory disease, PCOS, and cervical cancer. Check with your healthcare provider if your discharge seems unusual or is accompanied by symptoms like pain and fever. /r/n/r/n/r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.